33% of students in Pennsylvania are overweight or obese, and 1 in 4 Pennsylvanians has or will suffer from a chronic disease in their lifetime. The Pennsylvania Department of Health, through a 5-year grant from the Centers for Disease Control and Prevention, is charged with creating healthy environments in our schools, early child care centers, workplaces, and communities. By bringing government agencies, community partners, and resources together, we are implementing multiple health strategies at the same time to increase policy, system, and environmental supports that reinforce healthy behaviors. With support from this grant, the Pennsylvania Department of Health developed the Building Healthy Schools program. 95% of Pennsylvania's youth are enrolled in our schools. They spend 180 days per year and 7 hours per day in school. This is a long time, so the school environment is a logical place to implement obesity prevention initiatives to reduce childhood obesity. The Building Healthy Schools program offers strategies to reduce the prevalence of childhood obesity, addressing nutrition as well as physical activity and physical education.
The goals of the Building Healthy Schools program are to promote and implement supportive nutrition environments, quality physical education and physical activity, and ultimately reduce the percent of children who are overweight or obese in Pennsylvania. The department engaged 15 Pennsylvania school districts, a total of approximately 80 schools, to empower them to make a difference in the lives of our school-aged children through effective health and wellness policies and their implementation.
The Building Healthy Schools program is unique because any school outside of the 15 originally invited to participate could replicate the program in their own school. In addition, the program is designed to be over 2 years and include bite-sized pieces that fit into a school district's timeline. The first year is a planning and assessment year. In that year, they identify a wellness champion to lead wellness initiatives. They create or enhance a wellness council. They then do a series of assessments to determine the current state of wellness within the district, and then they create a plan that can be implemented in the second year. The second year is really important for implementing the plan that was developed in the first year, but also for creating relationships both within the school, within the communities, and that really leads to the sustainability of the policy and program that were designed to be implemented.
The department partnered with Penn State Pro Wellness to implement the Building Healthy Schools program. Their approach provides schools with program development and implementation, assessment and evaluation, capacity building, technical assistance, collaborative partnerships, and proven tools and resources. Through this program, Pro Wellness serves as an extended member of each district's wellness council. In addition, school support comes in the form of phone, email, and virtual and in-person meeting participation. We also provide professional development opportunities and promote professional development activities that others might be offering if we know that it helps one of our districts fill a need that they've identified.
So when districts have finished the first cycle, that includes the planning year and the implementation year, we really encourage them to go back and use the information they gathered from that assessment to create a plan for subsequent years. The sustainability of a program through the Wellness Council and then identifying those secondary initiatives really creates an opportunity for the district to continue to improve upon wellness while continuing to work on the first items that they identified and then going back and creating a secondary list and implementing across subsequent school years. Well, we really look at any progress made within the program as success. Really, we see that districts will identify several different priority areas from the assessment, but then we encourage them to look at just 3 or 4 to be accomplished in the first phase of the program to make sure that it is something that the district can accomplish and then also that those things can be sustained. We then encourage school districts to repeat the process over again so that they can go back to those originally identified areas for improvement and then work on those secondary areas as well. The Building Healthy Schools program really creates an infrastructure that allows schools to continue to create change in wellness areas and improve upon those for many years.
Our goal is really to make healthy living easier, accessible, and safer for all Pennsylvanians, which aligns with our department mission to promote healthy lifestyles, prevent injury and disease, and to assure the safe delivery of quality health care for all Commonwealth citizens.